Hi, I'm here to tell you about an exciting project called North Wales Together, Seamless Services for People with Learning Disabilities. It's all about how we can support people to have a good life and better services. It's for children, young people and adults across North Wales. So why have we created this project? Well, firstly, a law called the Social Services and Wellbeing Act says we must find out what people need. The Act says that social services and health must put the person first and let them have control of their support. Support people to sort any problems out early, before they become too big. Support people to live healthy and happy lives, and make sure that everyone works together to find out new and better ways to support people. To meet these aims for people with learning disabilities and their carers and families, a North Wales Learning Disability Strategy was put together based on what people told us mattered to them and other evidence of needs. The strategy sets out how we will try to make lasting changes to the way we do things in North Wales so that everyone with a learning disability can be supported to live the life that they want to. These are some of the things that people with learning disabilities told us were most important to them in terms of how we go about shaping support, meeting their needs and the aims of the strategy.
I guess the thing that's most important to me is family, people with a learning disability being heard and getting their voices across to other people, and basically just being busy.
Socialising, mixing and that kind of thing. Going to the theatre, yeah. Going to the shows or go disco dancing. And
I have got amazing good friends to be with, and my girlfriend, she's amazing because I love her, because in my future I would like to get married, really.
I find, a lot of people with learning disabilities, a lot of people, can have relationships. A lot of people we know are married. Like I met my partner through National Council.
Being around people, that's a key thing for me as well, because I just love being around people.
Important to me to get involved is do other companies, like working in England or performing in pantos, get myself involved with hijinks. Hijinks is the main thing at the moment because I've been on tour. That's a great experience, and all sorts would be, everything's amazing.
I really need people like disabled and people that are disabled. You're looking for us, people like anywhere. We need people like that.
And parent carers told us this.
A lot of carers, and myself included, would like the battle to be took out of it immediately, because it becomes a battlefield that's stressful for everyone involved. And stress then makes situations even worse and perpetuates in a lot of things going wrong.
My worry for the future is the cuts in services and the cost of services and the what's going to happen when going into supported living.
I think we need to get back to basics. I think we need to remember that people are people. I am a carer for an amazing individual, member of my family. She's totally amazing, but she tends to get defined by what she can't do. She tends to get defined by a list of medical labels, and the way I look at it is I don't introduce myself as a list of medical issues or problems. I could say, oh, here I am, I'm a little bit overweight, I'm 63, and I've got a couple of things that are wrong with me. I don't do that. Most of us don't. I don't think anybody does.
My son would really love a real relationship. And here's the 3-letter word, sex. But the reality is, who is actually going to help the people who support Mark? Everybody wants to help, but nobody wants to take the responsibility. And I find this happens in a lot of areas of the life of a person with a challenge.
When things go wrong and they break down, it's the service user that takes the brunt of it all. They're the person that gets confused, angry, especially if they have no speech or any way of communicating.
Me and you, maybe we can claim to have communication skills. I can speak, you can speak, we've got ears, we can listen, we've got the kit. So if we've got the kit, we're the ones that should take that step towards her. She's the one that's so-called got communication difficulties, but actually that's us.
I'd like to think that the support that was implemented in the beginning would stay the same, that the level of care and the staffing numbers would all be correct in terms of the person, what they need, not how much things cost.
But whatever I think happens in North Wales needs to be able to be continued. And if it's successful, keep going, because there is so many areas of their lives that go up, down, and then they're expected to carry on as though nothing's happened, and they are really affected, and so's the family. Things need to be stable and to carry on, and it's not just a tick box and a really nice little exercise.
So what happens next? The team will be working with people and organisations across North Wales to try to make the aims of the Learning Disability Strategy a reality. The team will be working in partnership with people with learning disabilities, their carers and families, and organisations to make and deliver plans to meet these aims. It's important that everyone has an equal voice and that decisions are made together. This is called co-production. So, we need your help to make this happen. Please get involved. Contact the project team, come along to one of our events, groups, or meetings, and together we'll make sure that people with learning disabilities are supported to live the life that they want.